Hello, thank you for joining in today. I'm Sarah Frazzini, Benco's Executive Director. I'm going to hand it over.
Hi, I'm Misty Sorte, Benco's Director of People, and Sarah and I are here today to start our five-part learning series that really dives into Benco's drug and alcohol policy. Today, we're going to talk about drugs, especially including cannabis.
I'm going to begin by going through the definitions of drugs according to Benco's policy. So, drugs include any non prescription medication or other substances which have a physiological effect when ingested or otherwise introduced into the body. These substances include, but are not limited to, illegal drugs. And because cannabis remains an illegal drug under federal law, there is no exception for cannabis use under Benco policy, including medical cannabis use. And the terms cannabis and marijuana are interchangeable, and so we do want employees to have that awareness. In addition to illegal drugs, substances controlled under federal or state law, including synthetics, designers, lookalikes, and inhalants. Prescription drugs, which are not used in accordance with the prescription. So if a Benco employee is using a prescription medication that may impair mental or motor function, the employee must inform their supervisor of that medication use. It is up to the Benco employee to discuss the medication with your prescribing physician and really understand the potential side effects of that prescription medication. Any potential impairment of the safe and efficient performance of duties caused by the medication must be discussed with your supervisor and or director prior to beginning work. So at Benco, we have Laura, who is our residential director. We have Misty, who is our director of people. We have Suzanne, who is our personnel director, and myself, Sarah, who is our executive director. So beyond your supervisor, your direct supervisor, coming and speaking to one of us about that prescription medication that you're taking would be really appropriate. And it really helps to initiate that conversation around, what potential parameters might need to be put in place. Are there potential accommodations that we need to be considering and talking through? To really provide good support to you so that you can provide good support to the people who are in our services.
Thank you. And I also just want to say, if you do have any other questions regarding prescription medication, we have a learning session devoted to this topic on September 4th at 2 p.m. So you can definitely log into that session or see the session afterwards on our YouTube channel. So we already talked a little bit, or Sarah just went over the definition of drugs as we define it in our Benco policy. We define alcohol as including any substance or beverage, including containing alcohol, ethanol, isopropanol, or methanol. We define under the influence as having any detectable level of a drug or alcohol in your system. And this includes, but is not limited to, blood, oral fluids, and urine. It also includes having consumed drugs or alcohol so recently that there is a reasonable possibility of impairment to safe and efficient functioning. We define on duty as including any scheduled work time, breaks, rest, or meal periods taken during the workday or night, as well as on Benco premises preparing for work, waiting to be assigned to work, or time spent after work preparing to leave. On duty also includes any time you are representing Benco. And Benco's expectation is that your actions, even off work, do not negatively impact the reputation of our organization or call into question your ability to safely care for residents. Because we just mentioned it, it's not on the slide, but I wanted to go over our definition of what it means to be on premises. Benco, it includes any and all Benco property, buildings, furniture, equipment, Benco vehicles, parking lots, and any location at which Benco business is conducted regardless of ownership. This includes an employee's personal vehicle on Benco's property, as well as travel time in the company vehicle or in an employee's personal vehicle while on shift or while traveling to work.
I had mentioned cannabis in the first slide. We're going to dive into that just a little bit further. So because cannabis remains an illegal drug under federal law, there is no exception for cannabis use under Benco's policy, including medical cannabis use. Cannabis is the scientific name for marijuana. The active ingredient in cannabis is THC. This category includes cannabinoids, THC, CBD, CBN, CBG, and CBC, and synthetics like dronabinol. The defining difference between hemp and marijuana is their psychoactive component. So THC is the psychoactive component. Hemp has 0.3% or less THC, meaning that hemp-derived products don't contain enough THC to create the quote-unquote high traditionally associated with marijuana. However, just as with CBD products, there are trace amounts of THC, and those trace amounts can add up in your system, causing you to test positive. So staff do need to be aware of this possibility because Benco cannot make an exception if a test does come back positive for THC. So really evaluate kind of the products that you're using and look and see, if it fits within Benco's policy.
Thank you, Sarah. We had a lot of questions regarding why cannabis is included in the Benco policy because it remains legal in Oregon. However, as you've heard already, Benco receives federal funding for the services we provide. We maintain contracts with the Center for Medicaid Services, Oregon Department of Human Services, and under these guidelines, for federal funding, we must maintain a drug-free workplace. Cannabis remains illegal under federal law, which prohibits Benco employees from using cannabis at any time in any form. This includes during off-duty hours. And I also just wanted to provide a little verbiage from the actual Work-Free or Drug-Free Workplace Act of 1988. And it specifically calls out that employees are prohibited from engaging in the unlawful manufacture, distribution, dispensation, possession or use of controlled substances in accordance with this requirement. And again, as far as illegal, because it's still federally illegal, cannabis is included.
Okay, we're going to jump into talking a little bit more about prescription medication. And as Misty mentioned, we do have another learning session on prescription medications that you can tune into. If an employee is using a prescription medication that may impair mental or motor function, the expectation is that the employee informs their supervisor of such drug use. It is the employee's responsibility to discuss with the prescribing physician and understand the potential side effects of that prescribed medication. Any potential impairment of safe and efficient performance of duties caused by the medication must be discussed with your supervisor and or director prior to beginning work. So some questions that you might ask your prescribing physician or think about for yourself to determine, is this something that I should have a conversation with my supervisor in regards to, does this medication impact your ability to perform your job duties? Does it cause drowsiness? Is it something that causes some mental or motor function impairment? Might you need an accommodation in your work environment as a result of taking this medication?
If an employee believes that they have a problem using drugs or alcohol, Benco really wants to make sure that all staff know that if an employee self-identifies as having a chemical dependency, the employee will be given an opportunity for confidential treatment. This benefit is available to any employee who makes voluntary self-referrals and is not a result of positive drug alcohol test. So if you wait until you've already been called in for testing, then it may be too late for you to be able to receive this kind of rehabilitative services. Each person's path to recovery looks different, so we don't have a one size fits all plan. Suzanne, the personnel director, and I can meet with you and provide you a complete list of resources and services to meet your individual needs. It's also important to note that when a person stops using cannabis who has been a regular consumer, withdrawal symptoms can occur, which can impact your day to day life and your ability to perform your job duties. We will be including a list of resources and services as well as websites for more information on post-acute withdrawal syndrome and provide information regarding the body's physical and mental response when suddenly discontinuing this use. Well, it is the expectation of Benco that staff do not use cannabis or other drugs. We are working with staff to ensure that everyone is treated with dignity and respect and free of any sort of judgment. Please reach out to Suzanne or myself for information. Those who speak with us will be given an individualized plan, and timelines will be clearly identified for when they will be subject to drug testing, which allows the employee to fully go complete rehabilitation. We will work with that staff to provide tools and resources to quit and to work with the individual on a timeline for testing that provides accountability and support throughout their recovery journey. All Benco employees have access to Benco's EAP program, which comes with the TELUS Health One app, which we are happy to provide and is also available as a link on our website. Through this app, employees can access a variety of wellness support, including help with addiction and recovery. So please reach out to Suzanne or myself or any of our admin team. As far as we're concerned, there is no wrong door in helping our staff.
And when we say reaching out, you can make a phone call to the main office and ask to speak, with Misty or Suzanne. You could send either of them an email. All of our administrative staff emails are on our website. Through TheraP, you could send an SCOM. And through Misty's communication on TheraP, she always shares a booking link that you can follow to book a confidential meeting with her. Misty has a wonderful, flexible schedule and is willing to meet with employees here at the Benco main office or meet with employees out in the community, in an area where the employee feels most comfortable. So, please take advantage of the different ways that you can get in touch and get in touch if you do have, something that you want to chat about. You have a team of support here at Benco. Benco really prides itself as an organization on professionalism, integrity, and the high level of care that we provide to those who we support and our staff. Maintaining a stable workforce that feels very well supported by Benco while keeping a drug-free workplace is crucial to our mission. We simply cannot risk the health and safety of the residents who are within our care. And that's why we have really emphasized this policy and want to ensure that our employees have a good understanding of that. We are here to answer your questions, to provide resources and support you as you navigate through this policy and what it means to you. Thank you for being here, listening, and if it does spark questions, please feel free to reach out.
Thank you.